Hi everyone, Joe here, Mrs. South Africa 2022, and I'm here with Dr. Reza at Anti-Aging Art. October is Breast Cancer Awareness Month, and we're all playing our part to help spread awareness. So Dr. Reza, what are you doing at your practice for Breast Cancer Awareness Month?
Generally, what we like to do whenever we have a special cause is to try to create awareness more than anything else. I think people need to understand what's happening. They need to realize that there's a lot that they can do for themselves and for their loved ones. So what we started doing is we made these t-shirts, we drew them ourselves here, all of us contributed.
Oh wow, that's fabulous. I love the shirt.
Yeah, it's just, it gets attention, which is what we want people to do. And then it starts the conversation of like, oh, what is this? And then you say, well, this is what it's all about. So we are selling these actually here at our practice, and all the money that we raise from the sale goes to a breast cancer association.
Fantastic. So obviously the shirt's here at the practice. You can also follow Dr. Reza and Anti-Aging Art on their Instagram and social media profiles. I saw fabulous pictures there. So what a great shirt, what a wonderful initiative. During Breast Cancer Awareness Month, one of the questions often asked is how important is screening and early detection?
Really important, extremely important. Obviously, knowing your genetics is important. Knowing whether you have the genes that contribute to breast cancer is a good start, so it's a good thing to check. But even if you don't have access to that type of testing, simple checking once a month, you have to choose the same type of the month, you have to follow the process. Our physios here have put up some nice videos it's Marge and Roxanne, they've put up some nice videos about the actual process of how you do your examination. But it's important to become familiar with your own body and make sure that you're checking every month. If you can detect it early, it's much easier to treat. The outcomes are much better. So really, it's not a cliche if you say that the answer's in your hands. It literally is.
I love that.
Check that. Yeah, the answer's in your hands. If you can check yourself, and that will lead to earlier detection and gives you greater survivability.
Wonderful. Once again, the message is if you're concerned about anything, reach out to your healthcare professionals. Now, Dr. Reza, obviously with Breast Cancer Awareness Month, there's a lot of information going out on screening, but not so much necessarily on what patients can do post a mastectomy. Now, I believe at the practice you support a lot of cancer patients post mastectomy.
So what we do is we work on various elements of the things that cause them disturbances in their treatment. So when it comes to things like chemo, where people have lost hair, we stimulate the hair growth. We use PRP, that type of thing, to stimulate actual hair growth. Working on their skin texture, tissue quality. Also on the scarring though, we like to help them. Whether you've had implants or not, the scar does tend to bug people. We work on the scarring.
And obviously that gives women their confidence back. Breast cancer is such a sensitive issue. It's so personal. A lot of women feel like they're stripped of their dignity and a lot of their self-confidence. So treating those scars and being able to give that back to them is pivotal. From a scar point of view, are there specific treatments that you use? Could you give us a little bit more insight into that?
So for sure, it is a delicate topic. It is something that does cause a lot of disturbance, and that's why wherever we can help, we must. It does even affect men. I think 2%, the last time I read about it, 2% of breast cancer patients were men. Come back to the scarring. We use platelet-rich plasma with microneedling. We use toxins into the scars, especially when we find that the patient is likely to have hypertrophic scarring or even keloiding. That entails using botulinum toxin and steroid injections, as well as sometimes pressure dressings. We teach patients how to look after the scars with massaging. We work on them with sometimes fillers or microfillers. There was a study done. It was what happens to chemotherapy and the survivability when the ladies were using lipstick or not using lipstick. And a simple thing like that, just that they had improved their appearance, they felt better, they looked better, and it actually showed an increased likelihood of surviving the treatment and surviving the cancer. So that's the way we look at aesthetics as well. It would make sense that if a simple thing like lipstick could do that, imagine what we could do with actual treatments in the skin. As long as the doctors who are treating the patients are happy for us to do things like fillers and toxins and platelets and that type of thing, then we are there to help as well.
That's wonderful. So bottom line is, Dr. Reza and the team at Anti-Aging Art are here very specifically to help you through those journeys. Chat to them, make contact, you can make an appointment, never be afraid to ask those questions, and Doctor will give you his honest opinion. You can head over to Anti-Aging Art and you can pick up these wonderful t-shirts to support Breast Cancer Awareness Month. And I think one of the most important things that you can do this month is speak to your friends. Speak to your mothers, your sisters, your aunts, the women in your life, and ask them when the last time they had a breast cancer screening done. You could just be saving their life and making such a pivotal difference to their families as well.